Today, the topic for discussion is basic life support and cardiopulmonary resuscitation. Moving on to the objectives. The objectives of this presentation is to assess the collapsed victim, to perform chest compression and rescue breathing, and how to place an unconscious breathing victim in recovery position. The basic life support is actually in the order of A, B, C. A stands for airway, B stands for breathing, and C stands for circulation. Earlier it was ABC, now it has been changed to CAB. This shows the importance of maintaining the circulation than the airway maintenance and the breathing. Now let's see what is chain of survival. As you can see in this picture, the chain of survival is mainly of four steps. The first step is early recognition and call for help. The idea behind the first step is to prevent the cardiac arrest. The second step, that is the early CPR, cardiopulmonary resuscitation, is to buy time. The early defibrillation, that is the third step, is to restart the heart. The fourth step, post-resuscitation care, is to restore the quality of life. In short, the four steps of chain of survival are early recognition and call for help, early CPR, early defibrillation, and post-resuscitation care. Now let's see what's the definition of basic life support. The basic life support is defined as a sequence of procedures that are performed to restore the circulation of oxygen in blood after a sudden pulmonary and/or cardiac arrest. Repeat, the basic life support are the group of sequence of procedures that are performed to restore the circulation of oxygenated blood after a sudden pulmonary and/or cardiac arrest. What to do in case of basic life? First is approach safety. The second one is check response. The third is shout for help. Fourth is open airway. Fifth is check breathing. Sixth is 30 chest compressions followed by 2 rescue breaths. Now let's go into detail about these steps. The first one is approach safety. The approach safety mainly includes four categories. The first is identify the scene. The second one, identify the victim, whether he is injured or not. The third is number of rescues. The number of rescues also plays a pivotal role in management. The fourth one is bystander. These are the things that has to be encountered in case of approach safety. Second one is check response. As you can see in this picture, shake shoulders gently and ask, are you alright? If he responds, leave as he finds it. Find out what is wrong. Reassess regularly. Shake shoulders gently and ask, are you alright? And then the third step is shout for help. Fourth step is open airway. The open airway is done mainly by neck extension. As you can see in this picture, by neck extension, the airway maintained is patent or airway is maintained patent. The other method is head tilt and chin lift. These are being done by lay rescuers, non-healthcare rescuers, and there is no need for finger sweep unless solid material is found in the mouth. So the airway maintenance is done by chin lift, neck extension, head tilt, and chin lift. The other method used for airway maintenance is head tilt, chin lift, and jaw thrust. As you can see in this picture, head tilt, chin lift, and jaw thrust. Now moving on the fifth step, that is the check breathing. As you can see in this picture, the rescuer is placing their ears over the patient's mouth to check the breathing sounds. The breathing sounds can be checked mainly by three techniques. First is look, then listen, and feel for normal breathing. In case of foreign body airway obstruction, the signs of mild obstruction and severe obstruction differs. Signs are you have to check is you have to ask the patient whether are you choking. If there is mild obstruction, the patient will respond as yes. If there is severe obstruction, the patient will be unable to speak or sometimes may no. The other signs in mild obstructions, the patient can speak, cough, and breathe. Whereas in case of severe obstruction, the patient cannot breathe, there will be wheezy breathing, silent attempts to cough, and the patient may go for unconsciousness. These are the two different signs of mild obstruction and severe obstruction in case of foreign body airway obstruction. If there is foreign body obstruction, what are things we have to follow? The first, as you can see in this picture, is back blows. The other technique is abdominal thrust. It is also known as Heimlich's maneuver. Now, after completing the breathing assessment, let's move on to the 30 chest compressions, which is a major, which plays a major pivotal role in case of basic life support. Now, let's see how we can provide the 30 chest compressions. As depicted in the picture, we have to place the heel of one hand in the center of the chest. Usually, it is placed in between the nipple regions. Place the other hand on top. Interlock the fingers. Why there is interlocking is the interlocking of fingers prevents slippage of the hand. And we have to compress the chest at a rate of 100 per minute. And usually the depth is 4 to 5 centimeters. And we have to make sure that there will be equal compression is to relaxation. And when possible, change CPR operator every 2 minutes. Let's repeat. We have to place the heel of one hand in the center of the chest in between the nipple region and place the other hand on top. And we have to interlock the fingers and compress the chest at a rate of 100 per minute at a depth of 4 to 5 centimeters, and there should be equal compression to relaxation. And when possible, change CPR operator every 2 minutes. And these 30 chest compressions should be followed with 2 rescue breaths. The main idea behind rescue breath is, or main procedures we have to follow in case of rescue breath is, first we have to pinch the nose so that the air won't escape. The second one is we have to take, as a rescuer, we have to take a normal breath. Then we have to place the lid over the patient's mouth and blow until the chest rises. Take about 1 second, and we have to make sure that the chest should fall, or we have to allow the chest to fall. And we have to repeat this procedure. First is pinch the nose. Second is take a normal breath. Then place the lids of the mouth, blow until the chest rises, and usually we should allow the chest to fall, and we have to repeat these procedures. The recommendations in rescue breaths are the tidal volume normal rate is 500 to 600 milliliters. The respiratory rate, give each breath over about 1 second with enough volume to make the victim's chest rise. Chest compression, continuously at a rate of 100 per minute. And let's go into the detail, or let's revise the steps that is followed in case of basic life support. First, as I mentioned before, it is approach safety. The second is check response. Third is shout for help. Fourth is open airway. Fifth is check breathing. And the sixth one is 30 chest compressions, which is the most important one, and it should be followed with two rescue breaths. And after recovery, we should place the patient in recovery position. As you can see in this picture, this is the recovery position the patient should be placed. This picture depicts how we should place the patient in recovery position, and we have to continue resuscitation until qualified help arrives and takes over. The victim starts breathing normally. Rescuer becomes exhausted. All these criteria or all these conditions, we have to continue resuscitation. We have to continue resuscitation until qualified help arrives and takes over. Second is when the victim starts breathing normally. Third is rescuer becomes exhausted. Now we'll see, when can I stop CPR? The conditions include when the victim revives. The second is trained help arrives. When exhausted to continue. And if it is an unsafe scene, or when it is physician directed, and if in case of more than 30 minutes, the chance of cardiac arrest is much more. In all these conditions, we have to stop the CPR. In which all conditions CPR may fail? When there is delay in starting, the CPR may fail, and in cases of improper procedures, that is, while giving breath, while giving rescue breaths, we forget to pinch the nose. That may result in escape of air. When there is no ACLS follow and delay in defibrillation, we should know that only 50% who receive CPR live to go home. And with the improper techniques, definitely the CPR may fail. And in those cases, when the patient has terminal disease or unmanageable disease, that is massive heart attack. In all these conditions, the CPR may fail. As a practitioner, we should have thorough knowledge about the basic life support and providing cardiopulmonary resuscitation, because stitch in time saves nine. Now let's see what are the complications of CPR. It includes vomiting, aspiration, wipe vomit from mouth with fingers wrapped in a cotton to prevent its aspiration, and reposition and receive the CPR. In excessive pressure application, there is high chance of rib fracture. And these are the main points in case of basic life support and CPR, and hope you understand. Thank you. Thank you for listening.